trypan blue under air technique. And to get adequate dilatation and to perform a good capsulexis, we use both adequate amount of viscodispersive and viscoelastic substance. And Phaco was performed by Phaco chop technique. But while during the last piece of the emulsifying the nucleus, I noticed there was a absence of red glow. Anyhow, we performed the Phacoemulsification completed with an IOL was implanted with almost utmost precaution. And on the first post-operative day, vision was 6-9, but there was a bluish tint visible on the fundus examination. This blue glow disappeared after second post-op day, that is after 1 week. So in discussion, trypan blue staining of the posterior capsule and vitreous commonly seen in case of the general compromise either due to trauma or previous surgery or pseudoexfoliation have been reported previously. In our case, the patient was a young male who had no sign of general compromise on pre-operative examination, or nor there was any history of trauma or surgery in the past. So we intraoperatively, I use both dispersive as well as cohesive OVD in the excessive amount to achieve adequate dilatation to facilitate a good capsulexis. So elevated IOP from the additional viscoelastic introduced into the anterior chamber might have forced the dye posteriorly, where it was able to flow through the structurally normal zonules. This our hypothesis supported by Merckx and co-worker and Pellet et al. Both are reported forceful inadvertent deliver of the high pressure dispersion of the blue into AC lead to migration of dye into posteriorly. And in another report, the Burkholder et al. Had published an observational case series where he had used iris detector before staining the capsule and had found inadvertent staining of posterior capsule with the dye. They had proposed the elevation of the iris with the detector and elevated IOP from the additional viscoelastic as a probable mechanism of the posterior capsule staining. So there are few preventive strategy reported in the literature, that is, we can use dye injection under the viscoelastic in place of under air, and we can create a viscoelastic barrier into the peripheral iridocorneal space, and we can use the mixture of trypan blue with the viscoelastic material such as Hilon GB3. So our conclusion is our case highlight the possibility of vitreous staining of the trypan blue in an eye with no clinical sign of zonular dehiscent and most probably due to raised IOP secondary to the OVD. So ophthalmic surgeons should be aware of this unusual complication resulting in poor visualization during the surgery and theoretically increased chances of intraoperative complication, and should employ the preventive strategy. These are the references. Thank you.
So you want to say that when there is chance of zonular dehiscence, you must use trypan blue with caution.
In cases of
if there is a chance of zonular dehiscence,
yes,
if you want to use trypan blue, you will use it with caution.
We can use mixture of viscoelastic substance with the trypan blue. Then we can prevent the migration of dye posteriorly. So we can use mixture, or either we can create a barrier by putting the viscoelastic in at the place of zonal dehiscence. So we can, in this way, we can prevent the posterior migration of the dye.
And also, it also highlights the importance of doing the AC wash after dye and then putting visco.
Yes. Proper AC wash before putting the visco.
Yes.
Visco.
Yes. Good presentation. So now